I'm Dr. Sagar Lonial from the Winship Cancer Institute of Emory University in Atlanta, Georgia. And I'm going to spend the next few moments talking about E3A06, which is a randomized trial of lenalidomide versus observation for patients with smoldering multiple myeloma. We know that smoldering myeloma is a very heterogeneous group of patients, some of whom act like MGUS and some of whom act like symptomatic myeloma, with a gray zone in the middle. And over the last few years, the International Myeloma Working Group has moved some of the smoldering patients who behave more like myeloma over to the category of symptomatic myeloma. But a question remains about what to do with patients with intermediate or potentially high-risk smoldering in the current definition that our current treatment is observation. So E3A06 was a randomized phase 3 trial looking at lenalidomide versus observation for these patients. And what we've presented for the first time at ASCO was data demonstrating a significant improvement in progression-free survival with a risk reduction of developing symptomatic myeloma and CRAB criteria by almost 80%. That was demonstrated at 1 year, at 2 years, and at 3 years. And in fact, in our phase 2 portion of the trial, we demonstrated that the PFS at 82 months was well over 78%. This is really landmark data, particularly from the largest randomized trial in smoldering myeloma. And while the use of lenalidomide was associated with some adverse events and a few cases of second primary malignancy, we did also see second primary malignancy in patients in the observation arm, suggesting that some of this risk may be associated with MGUS or smoldering, not just with treatment. Our conclusion at the end of the presentation is that patients with high-risk smoldering, as defined by the current IMWG presentation by Dr. Mateos or by the 2018 Mayo criteria, should receive early therapy, and that therapy would likely be either lenalidomide alone, as in our trial, or lenalidomide plus dexamethasone from the Spanish trial of several years ago, with additional clinical trial options ongoing.